Hand washing procedure. Push wristwatch and long uniform sleeves above wrist. Avoid wearing rings. If worn, remove during washing. Wearing of rings increase numbers of microorganisms on hands. Stand in front of sink, keeping hands and uniform away from the sink surface. If hands touch sink during hand washing, repeat. Inside of sink is a contaminated area. Reaching over sink increase wrist touching edge which is contaminated. Turn on water. Turn faucet on or push knee pedal laterally or press pedal with foot to regulate flow and temperature. Avoid splashing of water against uniform because microorganisms travel and grow in moisture. Wet hands and wrists thoroughly. Keeping hands and forearms lower than elbow during washing. Hands are the most contaminated parts to be washed. Water flows from least to most contaminated area, rinsing microorganisms into the sink. Apply a small amount of soap or antiseptic, lathering thoroughly. Soap granules and leaflet preparation may be used. The use of antiseptic exclusively can be drying to the hands and can cause skin irritations. The decisions whether use an antiseptic should on the procedures to be performed and the client's immune status. Wash hands using plenty of water and frictions for at least 10 to 15 seconds. Interlace fingers and weld palms with circular motion at least 5 times each. These facilitate the removal of microorganisms. Areas underlying fingernails are often soiled. Clean them with orange wood stick. Sometimes area under nails are taken for granted when washed. Make sure to clean them to prevent growth of microorganisms. Hands and wrists thoroughly, keeping hands down and elbows up. Rinsing mechanically washes away dirt and microorganisms. Optional. Repeat steps 1 to 9 and extend period of washing if hands are heavily soiled. This is to ensure the cleanliness. Dry hands thoroughly from fingertips to wrist and forearms with paper towel or towel. If used, discard paper towel in proper receptacle. This is to ensure safety and prevent the growth of microorganisms. Turn off faucet using clean and dry paper towel. Avoid touching the handles with hands. This is to prevent the contamination of washed hand. If hands are dry or chapped, a small amount of lotion or barrier cream can be applied. This is to have smooth hand and skin because some soap can cause dryness of the hands. Putting on sterile gloves. Wash and dry hands. After peeling off and removing outer cover, place package on table or work surface and open it. Carefully grasp the finger glove. It makes no difference which one by folded edge of cuff and pick it up. Touch on the glove. Hold glove by folded edge of cuff with thumb and first finger. Position other hand ready to receive the glove. Touching only the cuff, pull glove on the hand. Keep hands out in front of you and your uniform so that nothing touches glove. Leave cuff as it is. Do not turn it back at this time. Wait until second glove is on before making adjustment. Pick up second glove by slipping the fingers of hand glove under cuff of second glove and pick it up. Still holding glove on the other hand, do not allow glove fingers to touch bare hands or wrist. Keep thumb up and away from wrist. With glove hand under cup of first glove. Turn cuff back. Keep thumb up and away from wrist. Turn cuff back of glove on the other hand as in the same way. Make adjustment to fit the hand to fit fingers completely. not allowed to touch anything with your hand gloves before starting the procedure. Removal. Remove first glove by grasping outer surface or lower cuff. Taking care, touch only glove to glove. Pull glove inside out outer cuff. Taking care, touch only inside of glove. Remove, discard in proper receptacle. With ungloved hand, tap cuff in the remaining hand glove and pull it out, inside and out. Discard in proper receptacle. Wash your hands thoroughly from at least 10 to 15 seconds.